one and all. We welcome you to the International Webinar Series on Holistic Health, Well-being and Sustainable Development on occasion of World Environment Month 2022, commemorating Azadi Ka Amrit Mahotsav, nation celebrating 75 years of independence. Sri Holistic Health, in collaboration with Sri Holistic Health Foundation India and Sri Research Institute and Center for Art Sciences and Well-being. We welcome you all to the International Webinar Series. Before we start our session, let's take the blessings of Almighty.
शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः
The blessings of Almighty. We shall continue to today's session. Today we have with us Mrs. R. Vasmati. She is a research scholar in psychology from Garden City University, Bangalore. A seasoned veteran, specialization in Indian psychology, completed MPhil in public administration as well as masters in counseling psychology. She is a successful entrepreneur, having run a preschool in Bangalore for more than 10 years, presented numerous papers, national and international webinars, published peer-reviewed journals. We welcome you to the International Webinar Series and invite you to take over for your session on lifestyle diseases.
Thank you so much, sir, for the wonderful introduction. I welcome all the participants here. Am I audible?
Yes, ma'am.
Am I audible, sir?
Yes,
Yeah.
ma'am. Please.
Yeah. Thank you so much. I would like to thank Dr. Ravindra and Ms. Mary Florence for giving me the opportunity to speak in this in this eminent webinar. Without much further ado, I would like to go into the presentation as we have a limit in time. So I'll share my thing. Just give me a second. Sir, is it in the slideshow mode?
Yes, ma'am.
Yeah. Yes, today we are going to see a very, very important topic, lifestyle-induced chronic disease. Why am I saying it is important? Because lifestyle is the cause for many problems. And if you see, it is actually, today is International Yoga Day. And if you change your lifestyle, if you change it into a healthy sort, you would be avoiding many chronic diseases. So we are going to see how yoga and other physical activity help you to reduce these chronic diseases. Moving forward, what are lifestyle induced chronic diseases? So based on our lifestyle, there are many diseases which slowly comes into our body, and these are chronic in the sense it is there for a longer time. So if you see, like heart disease, stroke, diabetes, obesity, chronic obstructive pulmonary disease, and other even some types of cancer are there if our lifestyle is not healthy. So we are going to see what are the important lifestyle induced chronic diseases and what are the symptoms and how to prevent it through our healthy lifestyle. So when we say that we are having some diseases, what are the root causes for it? So if you see the physical inactivity, the first thing is the physical inactivity, alcohol abuse, unhealthy diet, tobacco, and in fact, mental pressure and stress nowadays, that's a very important factor as well, are the root causes for the diseases like heart disease, diabetes, cancer, chronic lung diseases, and even other non-chronic diseases as well. So, but here we are going to concentrate only on the chronic diseases, which are going to stay with us for quite some time and travel along with our age. So there are, when I say that this can be, these are the root causes, and through lifestyle, a healthy lifestyle, we can change the cause. But there are also certain unmodifiable risks which we cannot change through our lifestyle, and which are going to be present whatever we do, whichever medicines we take. Those are like ethnicity, that is which race you belong to. Certain race are prone to having heart attack, cardiac diseases more, certain for blood pressure. So there are certain ethnicity based diseases, chronic diseases, which you cannot change. The age is a very important factor. As you grow old, yes, there might be certain chronic disease like heart attack, or your BP or your diabetes slowly creeps on you. Then your genetic factors, that is your family history. If your father, if your parents or your forefathers had certain of these chronic diseases, yes, you are due to get it. And the last one is gender. Certain genders, for example, in diabetes for female especially, we have gestational diabetes, where only females would be affected by that type of diabetes. And heart attacks are normally more common in men than in women. So these are gender based. There are certain things which are gender based, and we cannot overcome that. So these are non modifiable risk factors, that is things we cannot change and we have to accept with along with the other things. But we can prolong, or we can postpone the thing without the onset of these chronic diseases. We are going to see how we are going to do that. First, we are going to see the first silent killer, which is the diabetes. Nowadays, in every household, we have one or two people having diabetes, and it is a fashion, in fact, to say that, yeah, I have sugar. I don't take sugar. Please don't put sugar in my coffee because I have sugar. People don't even feel bad nowadays to say that, because it has become so common. So what is diabetes? Basically, diabetes is often mentioned as diabetes mellitus, which is a group of metabolic diseases in which the person who has diabetes has high blood glucose or blood sugar, either because insulin is not there, or it is not produced, or it is very inadequate. Okay, so there are three types of diabetes. One is type 1, type 2, and gestational diabetes. When we say about, first I'll speak about gestational diabetes, because it's a only gender based, that is, it affects females during pregnancy. Some women have very high levels of glucose in their blood. So what happens is, and their bodies are unable to produce enough insulin to transport all of the glucose into their cells, resulting in a progressively rising level of glucose. So this happens only during pregnancy, and it can be controlled with exercise and diet, and some of them even after giving birth, their sugar levels go back to normal. So gestational diabetes is risky because it sometimes gives premature delivery, and there are other complications for the child, but it is not so dangerous, because with proper control of diet and exercise, yes, you can control the gestational diabetes. Now we come to the type 1, which is the insulin dependent diabetes, where here this body, the person who has type 1 diabetes the body does not produce any insulin. That is, they are actually referred as insulin dependent diabetic, or juvenile diabetes, or early onset diabetes, whereas this develops before 40 years or early teenage or early adulthood. This diabetes develops, and it is necessary that the person has to take insulin injections regularly, so that, and they should also always ensure that their sugar level is always in the proper thing, and they have a special diet to follow, and it is a lifelong, where it cannot be modified much with the lifestyle changes or anything. But coming to type 2, This type 2 is a non-insulin dependent diabetes where the body does not produce enough insulin. First type is there is no insulin produced, but here not enough insulin is produced, and the body does not react to the insulin. That is, it becomes insulin resistant. So approximately, if you see in the world, 90% of diabetic patients are type 2, and this is caused mainly due to lifestyle, unhealthy lifestyle. Sometimes it might be genetic, as I told you that your family history might be a cause, but most probably it should be of your unhealthy lifestyle, stress factors, that is a sedentary lifestyle, that is physical inactivity, and all these are cause of type 2 diabetes. So if you see the differences between type 1 and type 2, type 1 is caused by autoimmune disease. Here it is insulin, as I told you, type 2 is an insulin resistant, and type 1, it no longer produces insulin. But here the insulin produced is not enough. And as I told you, lifestyle changes cannot reverse the condition, whereas for type 2, yes, we have a chance to help the body produce more insulin effectively with diet and other exercises and oral medications. And beta cells are the cells which are present in your pancreas, which synthesizes, stores, and produces your insulin. So these beta cells are completely destroyed in type 1, and in type 2 it deteriorates slowly over time. So your beta cells are still active in type 2, and they are dependent on insulin for the rest of the life. So for an example, if a child gets this type 1 diabetes at 6 years, till end of life he is dependent on insulin, whereas for type 2, injections will be required, but you can postpone or you can control the level of your sugars with active lifestyle. So what are the causes for type 1 and type 2 diabetes? If you see, type 1, as I told you, it is caused by autoimmune diseases, hereditary predisposition, that is your family history, or endocrine diseases, viruses and infections, or damage or removal of your pancreas, or some unfavorable environmental factors, or drugs and chemical toxins. So these are the reasons for type 1 diabetes. But whereas for type 2, if you see, it's all based on your lifestyle, like overweight, that is obesity, sedentary lifestyle, if you have high BP, if you have high cholesterol level, if you smoke, all these contribute to starting of your type 2 diabetes. So what are the symptoms if you have diabetes? You have frequent urination, you have increased thirst, sudden pangs of hunger which you cannot control, and always you feel fatigue and weak. And there is a very unhealthy weight loss, sudden weight loss, which is very unhealthy, and people see you that your weight loss is not a very healthy one. And you have blurred vision, nausea, and when you get hurt, like you fall down or you get a cut or something, it doesn't heal very easily. So the healing time is very long for a person who has diabetes, and there is always a tingling sensation at the tip of your hands. So these are the symptoms of diabetes. And what are the complications if you have diabetes? People nowadays don't take it so seriously, but what are the complications if you have? You end up with permanent kidney damage if you don't treat your diabetes properly, or you have diabetic foot infections, peripheral neuropathy, that is, you have the nerves at the end of your foot being cut. There will be no sensation. It also is connected to heart attack, retinopathy, and blindness. So it affects your eyes as well. And there is a cerebrovascular disease, that is, it is connected with your brain. So it is very, very important that you take proper care of your diabetes if in case you are having, and with proper regime, how to control it. Next, how to prevent. So as I told you, increase activity level, doing yoga or any physical exercise, reducing the blood pressure. See, there is a triangle where once you get one thing, or you can connect it like a chain, or think of a garland where the flowers are your BP, high BP, your diabetes, cardiac problems, and all other chronic diseases. Think them as flowers, and the knot or the thread is your unhealthy lifestyle. So the unhealthy lifestyle ties all one to one, next. So if you have diabetes, you are due to get your BP, you're due to get your heart issues, you're due to get your lung issues. So these are all interconnected. So it is very, very important that we keep an eye and try to control once you get it, or prolong or push it as long as possible. And eating more fiber, that is a healthy diet, and limit the sugar intake, lower your weight, proper weight reduction, not going to some institutes and having a sudden weight loss, undergoing health checkup regularly. This is very, very important after 35 years. Previously, it was around 45 years. Yearly once you have to go for a health checkup. But nowadays, doctors are recommending, because of the stressful life, both in our professional as well as in our personal life, please undertake your health checkup from 35 years to find out what are the problems or the chronic diseases which are starting to take place, and reduce the salt consumption. And main thing is reduce all your stresses. So yoga will help you to reduce your stresses as well as increase your activity level as well. Moving on to the next silent killer or the chronic disease, blood pressure. We call it BP. Again, it is very common in India. Every household has at least 2 to 3 people having high BP. There are two types of blood pressures. The normal blood pressure is 120 by 780. 120 is called the systolic pressure, that is the upper part, and diastolic is the lower part, 80. So that is the normal 120 by 80. If it is less, it is called as hypotension, where it is 90 by 60. So the systolic is 90 and the diastolic is 60. And if it is hypertension, that is if you have high BP, it is 140 by 90, where the blood pressure is more. So when you what is systolic? I said systolic, that is the upper part is systolic, below is diastolic. What is that? So when in a normal, your blood is pumped from your heart through the arteries. So at the time when the blood is passing, the heart contracts, the ventricles contract, and the blood flows. So that pressure is the systolic blood pressure. And diastolic is after compressing or contracting, the heart relaxes. So that state of rest is called as diastolic. So your systolic pressure should be 120 and your diastolic pressure should be 80 for a normal blood pressure in a human being. But if again, I will tell you, if hypotension means abnormally low pressure, and I have given you a screenshot here where if your blood pressure reduces to certain level, what are the problems you will be facing? For example, if your BP is around, your systolic is around 80 and your diastolic is 50, you faint. Suddenly on the road when you're walking, if your pressure comes down to 80, 50, you faint. Or if it is 60 to 45, you feel confusion, you feel sleepy, you feel very, the grogginess will be there. And if it is 50 to 35, it ends up in death or coma. So it is very, very important to monitor the blood pressure if you are diagnosed with a low blood pressure. So what is hypertension? Here, hypertension is the common condition. Most, I would say around 80% of people will be having high BP, that is hypertension. And when you move on to your older age, mostly you will get high BP rather than low BP. When it is too high, what happens is the pressure of the blood flowing through the arteries is very huge. So it creates a heavy workload to your heart, and it can cause serious damage to your arteries, which will lead to your heart disease, stroke, and kidney disease. So again, we are connecting, if you see that heart disease, stroke, and kidney are connected to your BP, which is connected to your diabetes as well. So what are the issues? Like, why do you get hypertension? So main is high diet and sleep issues is the main cause. High salt intake, poor diet, again unhealthy diet, insomnia or sleeping for a few hours, and the sleep duration, like you don't sleep well, or either either you sleep for very few hours, like you wake up the whole night, do your projects, do your meetings and everything, and you sleep, catch up sleep for 2-3 hours and then run for your thing, then you end up finally with your BP level raised. Then energy imbalances like overweight, that is obese, being obese also creates, and an inactive physical inactivity, that is a sedentary lifestyle. Then there are also medical factors like failure to screen previously, that when you are feeling somewhat headache on the back of your head is a sign for your high BP. So when you get constantly a headache at the neck or neck region or your back of your head, then it is better you go and check your BP, and not taking regular medications which are given for that. And also, as usual, the family history plays a role, the genetics, that is, if your parents have hypertension, then you are due to get it. And premature babies who are born well before that time, low birth weight, and secondhand smoking. I know you know what is passive smoking, that you are not smoking, but you are forced to smoke if somebody in your house or in your workplace are chain smokers. What are the consequences? So hypertension leads to organ damage, it leads to heart disease, stroke, and kidney disease as well. And there is also stress, which is a very important factor attached to the hypertension. The more stress you go through, the more your BP rises. So it is always better to keep your stress level at the proper level. Next is psychosocial factors like ethnicity and socioeconomic level. All this also is a reason for high BP or the onset of the hypertension. When the difference or the symptoms between a high pressure and the low blood pressure are more or less similar, you have vision problems, unusual thirst, you feel difficulty in breathing, or you have shallow rapid breathing, you are always tired, that is fatigue. But there are few differences, that you faint when you have a low BP, whereas you get chest pain in high BP. So these are the main differences between low BP and the high BP symptoms, but the symptom as such are in both are common. And how to now prevent that? Again, first is exercising regularly, that is a very active lifestyle, eating healthy diet, stop smoking, cutting down on salt, cutting down on caffeine. Also, many people while they work, they continuously, instead of having lunch, they keep on having coffee or tea. So that increases your blood pressure. So you have to cut down on caffeine, limit the amount of alcohol intake. And the main thing is losing weight. That is, if you're obese, you are prone to get high BP. So it is better to reduce weight through exercising and healthy diet. Next, we are going to see the other silent killer, the coronary heart disease. So if you see diabetes, BP, they both bring heart disease. So it is again the third flower in the garland. So if you see the what is coronary? When I say coronary heart, what is the thing? Or the cardiovascular, we say it as in a very simple term as cardiovascular system. Which all are in a cardiovascular system? The cardiovascular system consists of your heart and the blood vessels. That's it. That's your cardiovascular system. The heart pumps the blood, which circulates throughout the body, supplying oxygen and removing your waste products. So when this is also this coronary heart disease is also called as coronary artery diseases. So when there is a buildup of fat on cholesterol in the artery walls, it can cause or it restricts the blood flow. So you think of a pipe where you pour the water, okay, and the salt or something is there on the walls, the sediments are there in the walls of the pipe. Slowly the pipe constricts, so the amount of blood which flows through the or water which flows through the pipe is less, and it restricts the blood flow. Because of this restriction, we get the chest pain. So the workload on the heart is more because the blood doesn't flow properly and it starts pumping more and more, and because of that you get chest pain, and there is a difficulty in breathing. And when the oxygen supply to the brain is disrupted, then you get stroke. So stroke is mostly connected with your heart disease, and stroke can affect any part of your brain, and it can vary severity from minor to fatal. And hypertension or a high BP is a very clear indicator, or we can say a predictor of heart attack and stroke. So when you get BP, high BP, you should be very, very careful. You should take control. You should change your lifestyle so that it doesn't end up in the heart disease. Now we will see what are the fixed causes which you cannot change. Again, as I told you, gender and ethnicity. There are certain things, so research which shows that men get more heart attack than women, as well as if you see Afro Americans get 30% more heart attacks than the European Americans. So there are certain ethnicity which is linked with this, and also as usual your genetics and your hereditary. If your forefathers or your parents have a history of coronary heart disease, yes, we should be very careful, and we should be very prompt in changing into a very healthy lifestyle. And aging, once slowly when you age, yes, your body parts will wear out, and it causes so many other problems, and one such problem would be your heart. So you have to take care when you are getting old. So the positive or thing, how can you stay healthy, is having a healthy diet, being physically active, and having vitamins and antioxidants. And if you are interested to have alcohol, have red wine, which is very good for your heart. But what are the causes for it? Diet and obesity. As usual, obesity plays a major role for your heart attacks. The unhealthy food which you take, smoking cigarettes, excess alcohol as consumption, and also hypertension. If you're having your diabetes, BP, or if you're obese, you have to be very careful that you are prone to getting in heart diseases. Now, when we move, as I told you, that modifiable, non-modifiable are your age, gender, genetic factors, race, and ethnicity. But your modifiable risk factor can be, which you can modify and which you can change, is you can control your blood cholesterol, you can control your weight, you can control your physical activities and become more active, you can control your diabetes, you can control your BP, and also stop or quit smoking. Now, when you get a chest pain, what are the signs? Actually, people say that heart attack, they give you a common 4-5 symptoms, but it is sometimes different to men and different to women. So for example, if you see for men, there is a discomfort or tingling in arms, back, neck, shoulder, jaw, and there is a chest pain for them and shortness of breath. But for women, we have additional symptoms, like you have heartburn-like feeling, you have vomiting or nausea, and you have unusual tiredness, sudden dizziness. So these are all extra symptoms which are present only in women and not in men. So we should be understanding what are the symptoms carefully and do the first aid or the precautionary as per the symptoms. Just don't go by the common, okay, I didn't get a chest pain, so I might not be having a heart attack. So please check for the signs, and if you feel any confusion, check with your doctor immediately. Heart attacks are silent killers, and please be aware that it is very important to give the first aid immediately. And I want to share this very important thing, because nowadays cancer has become a very common household disease. Every family has one cancer patient, either very close or distant, or many would have lost their loved ones to cancer. And if you see, the risk factors for cardiovascular disease and the cancer are same. That is tobacco, obesity, physical inactivity, poor nutrition, alcohol, diabetes, hypertension, all leads to heart disease, as well as they might cause you cancer. So it is always very important to understand this and keep in mind that this is common to both, and a very healthy lifestyle helps you to be away from these diseases. Now, for every other slide, we saw a common factor, that is obesity. So obesity is the root cause for many chronic diseases like diabetes, um, BP, hypertension, and cardiovascular diseases, and also cancer. So if you see, obesity has many issues. Like when you see a person fat, you cannot say them that they are obese. There are certain common symptoms which are there when you term them as obese. One is sweating. If you sweat more than usual and you have trouble in sleeping, or if you snore and there is a shortness of breath, then yes. And there are skin problems like itching, rashes, irritant skins. So those are a common symptom in adults if they are obese. And in children or adolescents, if you see, they have a dark velvety skin around the neck and the other areas, and they have sleep apnea. Sleep apnea in the sense they don't breathe for certain seconds, or say for 30 seconds they hold the breath without their knowledge. So that is quite dangerous sometimes, because if the duration extends, then it is going to affect them. It might lead to coma because your brain doesn't get the enough oxygen. So sleep apnea is a very again a very dangerous thing. So we have to take care of sleep apnea. So when you are obese, when the child is obese, they get into this. And shortness of breath with physical activity. And this corona period of 2 years, many children have become obese rather than being fit and strong. So these are the symptoms, and more physical activities will help them to turn back into their normal weight. And then what are the symptoms of, see, these are normal symptoms, but if you have a morbid obesity, in the sense it is going to be very dangerous, is if your optimal body weight, if your body weight is more than 100 lbs, 100 lbs is equivalent to 45 kgs. For example, if you are supposed to be, your optimal weight should be 60 kgs and you are 105 kgs, then yes, you are morbid, that you have, you are on a severe obesity level, that is on a morbid obesity level. And difficulty in breathing. You will not, even while sitting, you will not be able to breathe properly. So these are the symptoms of morbid obesity. Now, what are the causes? If you see the causes, we know eating too much of junk food. Definitely, stress is a major factor. So many people eat a lot while they are stressed. So for example, they eat junk food. So if you're stressed with your due date or something, they start munching, they start eating, and that results in obesity. And poor sleep. When you don't have a proper sleep condition, yes, you end up in being obese. And but there are also certain things, non-modifiable risk, as I told you, genetics. So in your family history, if everybody are obese, yes, you are prone to become obese, but it can be prolonged by doing by being very active and also undertaking a healthy lifestyle diet. Then certain medications, when they give, yes, it makes your body obese, and hormonal imbalance also causes obesity. And what are the consequences of being obese? We have seen all the consequences already. One is heart disease, diabetes, kidney damage, fatty liver, cancer, high blood pressure. So these are the consequences of being obese. And a very sad fact is that India is in the third place of having obese children. After the COVID, we are in the third place. So watching the diet or restrictions of our kids become very, very important, and making them physically active is going to be the first priority among parents in the coming years. Next, but can we tell a person just by looking, saying obese? No, there is a scientific calculation. There is an empirical way to say that, yes, this person is obese, which is a body mass index. So how to calculate a body mass index is very simple. Your weight, whatever your weight is, for example, 60 kilograms, and your height. For example, here it's 1.52 centimeters, which is, we have to convert it into meters and square it. So weight by square gives your BMI, which is body mass index. For example, 25.96. This number indicates whether you're obese, normal, below weight, or extremely obese. So we will see how it works. So here is the body mass index. if this number BMI is below 18.5, then you are underweight. If it is between 18.5 to 24.9, you're normal. If you're 25 and 29.9, it's overweight, and then it is obese, and above 35, it's extremely obese. And this is not, it differs. BMI calculation differs according to your height and weight, and it is different for each person. So this person, if you see, 25.96 falls under the overweight category. So he or she should do proper lifestyle changes to become normal. Now, how to prevent obesity? So we have to change the sedentary lifestyle. We have to avoid stress, eat more fruits and vegetables, get enough sleep, get rid of smoking, drinking, excess alcohol, avoid junk food, do physical exercise, drink enough water, which is very important nowadays. Kids don't, or even adults don't drink enough water. So intake of water is very, very important because it flushes out all the toxins from your body and makes you healthy. So this is a very important thing to prevent obesity. Now, the last one we are going to see is chronic obstructive pulmonary disease, which is also which is connected to your lungs. It is also based on, again, with obesity and other issues with smoking. So this chronic obstructive disease is basically based here. If you see, I have given you your lungs. So one side your lung is healthy and the other side has COPD, that is chronic obstructive pulmonary disease. So the air, when you intake, it goes through the bronchial and there are small flower bud sort of thing at the end. So that actually filters the air and it changes that the transformation of air happens there. So when you are having the COPD, what happens is the mucus, it goes and obstructs the bronchiole. So that path, as how I said in arteries, if the, or in the pipe, if the sedimentary is there, then flow of air is blocked. Same way here, the bronchioles become very narrow and the air or oxygen which passes through is very less. And that actually distracts this alveolus and that causes so many respiratory issues. So what are the causes for this? One is, we know, smoking and household air pollution inside the house. If the dusting is not done and there are fungus and there are other reasons, then air pollution inside the house is also a biggest cause for COPD. And asthma, post-tuberculosis, a person may develop COPD. And as usual, we have the genetic susceptibility and abnormal lung development. So abnormal lung development and genetic susceptibility becomes a non-modifiable thing. But all the other things, yes, we can change. They are all modifiable risk factors which can be changed through your lifestyle. And what are the symptoms if you are having COPD? So you cough for weeks. There is a dry cough, or you cough with phlegm. So, and your blueness in the tips of your of the fingernails, that is the, here it's your fingernails are the indicators of many diseases. So if your lips are blue or the fingernails are blue, then it is time for you to see the doctor immediately. There is a tightness in the chest, shortness of breath, and frequent respiratory infections, and also lack of energy. Always you feel tired, always you feel fatigued. So these are the symptoms of COPD. And there are 4 stages in this: mild, moderate, severe, and very severe, where the very severe is airflow is very less, 30%, and it leads, it's actually a life-threatening thing, because the low oxygen level can make you go into coma or death. And 50% is where it is severe. And again, you need to be hospitalized for that. And moderate is around 50 to 79%, where you feel breathlessness, coughing, wheezing would be there. So again, you have to check, take medications properly, and you can reverse at this stage. And mild is, again, you can reverse it with proper exercises. And what are the complications? If you see, the complications are respiratory infections, lung cancer. COPD without proper care leads to lung cancer, heart problems, pulmonary hypertension, sleeping problems, as I told you, sleep apnea, and osteoporosis, that is thinning of your bones. So these are the complications. See, you might think respiration, associated with lungs, but see the various parts of the body it affects. So each disease, whatever the chronic diseases, all are related to various parts of your body. And if your lifestyle is not healthy, then it might lead to many severe complications. And how to prevent this? We have to quit smoking, have a healthy diet, take nutrition supplements, do breathing exercises like pranayama, avoid exposure to fumes and dusts, and improve both indoor and outdoor air quality by planting more trees, keeping the surroundings clean and neat. And so now what should we do? So we have seen all this. What should we do? We have to quit smoking, quit alcohol, eat healthy food, be very active, undertake yoga and breathing exercises. So if you change your habits, it changes your life. A healthy lifestyle and a healthy diet leads you to avoid or prolong being affected from all these diseases. Thank you very much. Now I'm open to questions. If anybody have any questions, you can ask me. Any questions from the participants? Am I audible?
Yeah, thank you, ma'am, for your wonderful session. Due to paucity of time, we are not able to take any queries as of now.
Okay,
Definitely, we will take it up one more day. It's very wonderful session and insightful. Whenever the time permits.
Okay, thank you so much for giving me this opportunity. Hope this session has been useful to all the participants to create an awareness about lifestyle-induced chronic diseases. Have a healthy lifestyle, do yoga, do pranayama, and be very healthy and stay healthy. Thank you very much.
Once again, on behalf of Sri Holistic Health Foundation in India and Sri Research. Thank you, ma'am. Once again, on behalf of Sri Holistic Health Foundation India and Sri Research Institute and Center for Art, Sciences and Wellbeing, on behalf of all the participants, we wish you all the success and look forward for more sessions. The participants, quickly fill up the feedback form. It's provided in the chat box, and we will be restarting the meeting in another 3 minutes. You quickly open the feedback form. We'll be restarting this meeting for the international webinar to be scheduled at 7 p.m. So kindly immediately join back. Feedback has been shared in the chat box. Quickly fill the feedback form and rejoin again. Dear participants, quickly fill up the feedback form. We'll be closing the in 2 minutes, and we'll be restarting the session for the international webinar scheduled from 7 to 9:30.